Today we'll talk about glomus tumor. So it's a tumor of the myoarterial glomus, which is composed of vascular channels and surrounded by proliferating glomus cells. So in this tumor, we have vascular channels along with proliferating glomus cells. Variable amounts of glomus cells, blood vessels, and smooth muscles can be found in this particular tumor. Epidemiology, it is comparatively uncommon disease that appears at birth and increases from 7 years of age. Adults from third to fourth decade of life are more commonly affected here. There's no sex predilection, that is, males and females are equally affected. And subungual lesions, if you see, are more commonly seen in women than in men. This glomuvenous malformation can sometimes be present at birth also. Familial and autosomal dominant forms have been identified. Multiple inherited glomangiomas, that is seen if there's any glomalin gene on chromosome 1p 21 22 mutation. So if there's any glomalin gene mutation, that causes multiple inherited glomangiomas. So there'll be many glomangiomas in this. Clinical features, this particular lesion presents as a pink or a purple solitary nodule. So there'll be only just one nodule and it is around 1 to 20 millimeter in size. Conspicuously, it is painful. Direct pressure, change in temperature of the skin can cause pain. So that is on exposure to cold, it can cause pain. Sites affected are hands, that is on the fingers and palms, extremities, head, neck, and penis. Tumors beneath the nail are very painful, and nail has a bluish red flush when there is a tumor present beneath the nail. It may also involve internal organs, and in subungual glomus tumor is associated with neurofibromatosis type 1. If there's multiple, they're larger, darker, they're bluish in color, they're painful, and they're scattered if they're multiple, but usually they are single. Spreading of the limb may precede the development of a palpable tumor, and the extracutaneous glomus tumor, that is, glomus tumors which are present other than in the skin, they are in the gastrointestinal tract, bone, mediastinum, trachea, mesentery, cervix, and vagina. So these are the sites where we have to look for if a patient has a cutaneous glomus tumor. The diagnosis is by MRI and CECT. So this is the lesion of the glomus tumor. That is how it presents, a solitary lesion, right? Bluish, pinkish, solitary nodule. Glomuvenous malformations are inherited as autosomal dominant inheritance. There's a mutation in this glomalin gene. They appear during childhood or in adolescence. They present as multiple soft red to bluish nodules which are widely distributed. And the lesions will thicken and become more bluish with time. So here we can see the glomuvenous malformation. The color is bluish here. You can note the color which is blue in color, right? So these are the lesions that you see in glomuvenous malformation, bluish lesions. And again here, this is also called as glomangioma. You can see large clusters of these papillary nodules which are bluish in color. They confluent centrally as well. They're lobulated, well circumscribed lesions which are situated in dermis. And smaller lesions are very cellular and painful. Larger lesions are angiomatous and painless. So small lesions will be very cellular and they'll be painful, whereas large lesions are not that painful. Glomus cell will present as a cuboidal cell with well-marked cell membrane and nucleus, which is arranged in a single layer around the endothelial cells. So these glomus cells will be arranged around the endothelial cells of the vessels and the cuboidal cells. Electron microscopy, we see glomus cells which are transversely cut in smooth muscle cells and mast cells around the tumor. There are no nerve fibers here, and it is positive. The tumors are positive for smooth muscle actin, negative for desmin, positive for actin. CD34 would be positive. And malignancy, if it transforms into malignancy, it is called glomangiosarcoma. So these are the histopathological features. With typical case of glomangiomyoma, there are vascular channels here that you can see, the vessels being present with smooth muscle and thin layers of the glomus cells around the smooth muscles is present. Okay, solid type of a glomus tumor, which has got well circumscribed dermal nodule. You can see a well circumscribed dermal nodule with tiny vascular spaces in between, tiny vascular spaces. Again, this is again a solid tumor with monomorphic round cells which are present, and they have eosinophilic cytoplasm. The round cells with eosinophilic cytoplasm. This is again a photo of glomangioma, whereas blood vessels are present. That's why it's called as angioma. Here you can see the vascular spaces here. Okay, cavernous vascular spaces. And then this is glomangiomyoma, which is smooth muscle is involved. along with blood vessels. Glomus cells, smooth muscle, and blood vessels. Spindle shaped cells with pink cytoplasm and glomus cells. We can see in this particular photo. Differential diagnosis would be if it is solitary, you should differentiate from leiomyoma, eccrine spiroadenoma. If it is multiple, you have to differentiate from cavernous hemangioma and blue rubber bleb nevus. So, this blue rubber bleb nevus would be painful. Even leiomyoma is painful, so you have to differentiate it from other painful skin tumors. You have many painful skin tumors like angioendotheliomas, leiomyomas, hydradenomas, osteoma cutis, fibromyomas. So we have to differentiate from all of them. Treatment, surgical excision is the one which is curative treatment, electrodesiccation and sclerotherapy also. Since there are blood vessels involved here, sclerotherapy can be tried. It rarely recurs once you remove, and recurrence is mostly seen if it is a deeper lesion, right? So that's about the course of the disease.